Hi, this is Jeannie Cordes from Omaha, Nebraska. I've been a nurse for 8 years. I've worked in a critical care recovery hospital for that duration. Um, I've held many positions within that facility as well. House supervisor, charge nurse, wound care nurse. They like to kind of help us out and keep things interesting and help us learn a little bit too, as while we work there too. We do have a high turnover rate at that facility, so we do have to be a little flexible as well, and kind of take over some spots if we are short in a certain area, whether it be on the floor or in wound care, or if maybe they need help in as the charge nurse. So anyway, our patients come in pretty debilitated. They have prior to admission, they have been in the ICU, and then they are in our facility for at least 25 days. We do provide care to primarily Caucasian geriatric patients, but we do take care of Spanish-speaking and Native American Indian as well. A lot of violence from people on the reservation. So anyway, things I would want to learn from this class: I need to be able to communicate more effectively, I guess, make things just go smoother in my communication with them. However, we do have a lot of barriers, language barriers. We have to use the phones, so I don't know how that's going to work out. Well, in present time, probably not. But as a nurse practitioner, yes, that will be better. And I also probably need to be able to improve my ability to identify values, cultural values, and their perspectives, what they find important to them, or in communicating and asking if that's appropriate to ask them that, but I would think so. So in our communication with the patient, what's important to them. So anyway, obviously it's a difficult area, but I really do like culture. It's a very important and interesting area, but it can be challenging, especially I know where I'm at. There's a lot of barriers that we deal with. Because I just speak English, and however, the patients that we deal with at our facility, they either speak English or they do not, and otherwise they do not want to even attempt to, and some of them even try to refuse the interpreter phone, so they don't even want to try. So a lot of barriers, but I'm sure as a nurse practitioner, or at least I would hope, that would be an easier area, especially if they're coming for care. So I hope that I learn a lot from this class. I think I will. This will be very interesting. I love the area, and it will be a great next 8 weeks. Thanks, everyone.